In today's Medical Watch, addiction and COVID-19.
New study findings uncover a link between substance abuse and a higher risk for infection. It was a global health crisis long before SARS-CoV-2, opioid use disorder. Now, researchers from the National Institute on Drug Abuse say those abusing the highly addictive drugs may suffer worse when it comes to COVID-19. Compromised lung and heart function may play a role, but experts say there are other factors at play.
When we look at groups of people who are at higher risk from coronavirus, we start looking at people who are more and more socially marginalized, and I think that that's true of our substance-using population.
The study team analyzed millions of non-identifiable electronic medical records from patients across the U.S. They found people recently diagnosed with substance use disorders that included alcohol, cannabis, cocaine, and tobacco, in addition to opioids, require more care.
As we're diagnosing patients with substance use disorders, we always think, how do we get them into treatment? How do we counsel them on reducing their risk from their substance use? How do we deal with the medical complications of substance use? But along with that, now we have to really start to focus on how do we counsel these patients, particularly on how do you prevent some of the complications? How do you prevent yourself from getting coronavirus in a way that we may not have been doing as intentionally before?
Looking at inpatient care, those with addiction problems had a 41% hospitalization rate compared to 30% for those who did not. And the death rate among patients with substance use disorders was 9.6% compared to 6.6% in patients with no addictions.
You know, these people may be coming from communities where they don't have the resources to keep themselves healthy.
One group in particular, African Americans with a recent opioid use disorder diagnosis, were more than 4 times more likely to develop COVID-19 compared to whites. Hypertension, diabetes, cardiovascular diseases, and renal diseases, risk factors for COVID-19, played a role.
The paper highlights the need to both screen and treat patients with substance use disorders as part of a strategy to address the coronavirus pandemic. So if we're identifying populations that are at risk and they have a disease that's modifiable, then we should treat that disease.
And another alarming finding when it comes to substance abuse, opioid overdoses in Cook County are up 50 to 100% compared to the same time period last year.
Yeah, doctors believe it may be due to drug users isolating themselves during the pandemic, using alone with no one around to offer naloxone or help in the case of an overdose.